So hello, and thank you for joining our webinar today, where we're going to talk to you about a career in environmental health. Our aim today is to showcase how varied a career in environmental health can be. So if you're looking for a change in career, this webinar is certainly for you. So COVID-19 has brought real uncertainty for so many people who really don't know what the future holds for their jobs and for their careers. But there's never been such an exciting time to join the environmental health profession, and never before have individuals with environmental health skills been in such demand. So if you've not considered it before, we hope we can encourage you to look a little bit more closely at environmental health. And to help you to do this, we've got a fabulous panel with us today who've actually made that switch in their careers. So without further ado, I'm going to introduce you to them. And with us, we've got Sam Watkins, Lisa Cobb, and Richard Chubb. So to start off, I'm going to ask our panelists to tell us a little bit about their current role, why and when they decided on a change of career. So first of all, then, coming to you, Richard, would you like to sort of introduce yourself and give us a little bit of background?
Yeah, sure. My name is Richard Chubb. I'm on a secondment at the moment from my local authority, which is Nottingham City Council, to the joint inspection team, which is based in the Local Government Association. So my job involves managing some environmental health officers and being part of a multidisciplinary team, and we inspect tall buildings with dangerous cladding systems on the outside of them, and then assist the local authority to take enforcement action against the responsible person to basically remove the cladding panels and make the rest of the building safe as well.
Right, so I suspect then, Richard, that your job was created really as a consequence of the awful tragedy at Grenfell. Am I right?
Yes, that's right. I came into the team about a year ago, and yes, it's in response to the Grenfell tragedy when a lot of people lost their lives, and obviously there's been an ongoing inquiry into the reasons for that, which makes for a very interesting and constantly changing sort of enforcement agenda. So we've been set up in response to that, and are part of the government's response to that tragedy, basically. So yes, we're very busy inspecting across the country.
Yeah, can I ask you, Richard, what did you actually do before you did environmental health, and what made you switch?
Yeah, sure. I first graduated in 2002 with a degree in applied biology, and became a biologist for a pest control company. So I came across the work of environmental health via that. I was trying to keep hotels and factories open that the environmental health officers were trying to close at the time. So, and I was quite impressed by their professionalism and the sort of varied nature of their work, basically. So, and I thought actually, that's something that I'd quite like to do, and took upon myself to do a fair amount of research into the profession prior to undertaking a master's.
Okay, thanks, Richard. So I'm going to turn now to Lisa. Hi, Lisa.
Okay.
Would you like to tell us a little bit about your current job, your role, what you did before, and what made you make the switch?
Okay, yeah, interesting for me. I'm head of health and food safety for a catering company. We've got units all over England, UK, across Ireland, as well as globally. I look after the UK and the Ireland side of the business. I moved into environmental health quite late in career, really. So I was previously in sales, and it was when I had my first child that I decided I didn't want to be in sales anymore. I didn't want to travel. So for me, being open and honest with you all, I decided I wanted a career for my local government, because for me, I understood there was, flexi hours, it was local, it was 5 minutes from home, all of those nice things that you hear about working for a family orientated type of environment. So I applied for various roles that I had the skills for, And one of those was admin in environmental health. And I was in my 30s when I did that, and very quickly decided that actually I really enjoyed what the other guys were doing in the technical teams and the reactive teams, and took the plunge. I had A levels. I was going to university to do teach training. Decided very quickly in that really was not for me at all, and then jumped onto the master's degree at Derby Uni.
Great, thanks, Lisa. And I'm going to come finally to Sam. And I've left you to last, Sam, because you're our most recent environmental health graduate. And I know that you graduated in 2020 with an MSc. Do you want to tell us a little bit about your current role and what you did and before, and what encouraged you to make that switch?
Yeah, of course. Hi, good morning. My name's Sam. I work for Monmouthshire Council, the Environmental Health Department, and I'm a programme lead for the Track, Trace and Protect. I'm fairly new. I started in June. So I worked with a team that was put together at speed when COVID all came about. And yeah, it's just really gone from strength to strength. I decided on a career change. My background is teaching, so I've been used to teaching 16 to 18-year-olds in further education. Catering was always my background, and I had a huge passion for environmental health. Unfortunately, it was something I wish I had followed up when I left school and went on to further education, but unfortunately at the time that didn't happen. And it was only recently that I've been in a position to really pursue this. My daughter went off to university. I had time to invest in my career, and I approached the University of the West of England, and yeah, I studied for my master's, and I completed it and got my grade in December. So it's fantastic. I'm just loving life, really.
Brilliant. So you've all come from very different backgrounds with different experiences and different motivations to enter the career. And I think that's one of the issues with environmental health. There's a lot of people don't realise, they don't know about the profession, but they actually don't realise, you know, how varied environmental health can be. And Richard, I was really interested to hear that obviously you'd had some experience of environmental health before you decided to pursue a career in it, because you came into contact with environmental health professionals. What about for you, Sam? Did you have any kind of experience of environmental health before you decided to change your career?
I think my experience in environmental health goes back to my teaching days, when they would turn up and announce, normally at lunchtime, to do our food inspections. And I was just really interested in what it entailed and just fascinated by the whole process, really. And yeah, that kind of just spurred me on really to following it up. Like I said, my daughter went back to, my daughter started uni. I had time to invest in my career. And the diversity of the role, I just found it was just very interesting. The skill sets kind of match mine, so like dealing with the public, because I was used to doing that. The communication skills, I think I talk a lot, and just achieving clients, just to mention a few. And I just thought, this is the career for me. I just, I was very nervous. I made the move, and yeah, it was the best thing I've done, Kate. I really love it.
Thanks, Sam. And obviously for you, Lisa, you joined a local authority in an admin, if you like, capacity, and saw what the people around you were doing and thought, yeah, I'd like a bit of that. And I guess that was your first introduction to environmental health. What about before that? Had you had any experience of environmental health?
No, prior to that, none whatsoever. So it was all new to me. So it was really an eye-opener, and a bit like what Sam said, I almost regret not being aware of that sooner and not following it sooner. But I did, and I've still got another 20 years to work before pension time. So it's never too late.
Yeah, and you know what? So many people say that to me. They say, if I'd have known sooner, I would have made the switch sooner. And so there's a real big challenge for us, isn't there, to get the message out to more people about what this is all about. So let's talk about then the sort of qualification side of things, because there are several routes into the profession. You can do an environmental health degree, you can do an MSc, there are now degree apprenticeships. Sam, tell us a little bit about your sort of entry route.
Yeah, I did the master's environmental health. There was two options. You could have completed it full-time, which was a 12-month programme, or part-time, which was a 2-year programme. Due to my circumstances, I had a daughter, I've got a mortgage to pay, I had to choose the part-time option. So I took a stopgap job to allow me to train at the same time. And it's, you know, it worked for me, it suited me and my circumstances. Did you want me to explain a bit about the course at UWE?
Yeah, why not? Let's hear a little bit about the sort of subjects that you studied, and you know, what were there any of those subjects that you had a preference for?
Well, my big passion was always the food side. I think that was coming from my background of catering. But I enjoyed the interactive nature of the course. We went on field trips, which were relevant to the disciplines we were studying. The food unit probably was my favourite unit. We were in the labs. We did mixture of fish, meats, vegetables, just really all unusual items, and they were kind of from all over the world. It was trying to get us, you know, I could recognize all these fish from their lateral lines. You know, it was fascinating really what we were learning. The interactive nature of the course, it just brought the theory elements and it made it more of a diverse way of learning. It wasn't so much classroom led. It was just really interesting. But no.
Yeah, I think that's one thing about the course, isn't it? It is very practical, it's very hands-on. Yeah. Lisa, what about you and your sort of qualification route?
Yeah, so I same as Sam, went into the master's degree. I chose a part-time route as well. I was working at the time in environmental health, but not as an EHO. So I also had a child, he was 2 when I started uni. So for me, the part-time route was the only option for me. Fortunately, I had support from my husband. So for me, managing the coursework, it was quite different. I was on the same course at the same time as Richard on the call here. And I can remember quite a lot of colleagues that were on that course were able to do a lot of the work literally the days before the assignment was due, whereas for myself I had to be really, really disciplined, and I had to set time aside each weekend to do it because I just didn't have the ability to stay up all night and work into the late hours like some people did as a typical student would normally want to enjoy their course, but the end result was the same.
Yeah, do you know, and I think it's really marvellous that, you know, you've done the training, but at the same time, you know, you've done that with family commitments, and there was that option to do the part-time study. And I think, you know, that really appeals to a lot of people. In terms of your university experience, Sam, tell us a little bit about university life then, because you were in Cardiff, weren't you? And Richard and Lisa, were you both at Derby? Did you study both at Derby?
Yeah.
Tell us about university life, Sam.
Yeah, I really enjoyed my 2 years. It was flexible. Like Lisa says, I had my family. I was working as well. I used to find it quite challenging. And I was one of these ones that was up all night completing assignments. And I probably, if there was 5 minutes to the deadline, that was me. Normally.
Okay. But you've got there in the end.
I got there in the end, and it was
great.
well worth it. Yeah, I loved it. It was just, there was so much support on hand. You know, they understood if there was a problem with the deadline. You know, it was really good.
So Lisa, can you tell us a little bit about a typical day in your current role? Tell us a little bit about your job and what it involves.
Oh gosh, okay. So I'm responsible for a team who look after the health, food and fire safety elements of the business. So I have auditors that cover the whole country, and they go out and visit the different units to do the auditing and the coaching side. For myself, it's much more about setting policy, creating policies, whether that's for new and upcoming legislation such as Natasha's law, making sure that the business is compliant with that. The strategy, the forward thinking. I've also more recently, particularly with the COVID pandemic, been doing a lot more work with our group business. So that's been really exciting and something a little bit different for me as well. No day is the same, and that's a big piece of what I really do enjoy. I could be talking to EHOs, I could be talking to our primary authority, clients, landlords. We have quite a different, we don't own a lot of the premises. We're landlord, we have a tender, we're in there for 5-10 years. So there's lots of different relationships that need managing and supporting.
Thank you, Lisa. And I think that really illustrates really well. There are a lot of the things that you see in the headlines, a lot of the big stories around current issues. For example, allergens, and you mentioned, Lisa, Tash's Law, you mentioned COVID, the UK response to COVID. Richard, you mentioned Grenfell. And I think the really amazing thing about environmental health is that environmental health practitioners are involved in all of these things. There is rarely a day, you know, the papers don't have something current that environmental health officers are really intrinsically involved in. So turning to you, Richard, tell us about a typical day for you.
My days, when I'm not working from home, are very so they're inspection based, basically. So a typical day on an inspection is we stay in a hotel the night before so that we can start on site as soon as possible in the morning. We then do a day's inspection of a tall building. So we're going into all the nooks and crannies, the service risers. We're inspecting the outside of the building, looking at the sort of cladding systems, looking at smoke extraction systems. It's a very specialist sort of area, and one that I've had to learn on the foot sort of thing. So we work in a team with building control people, with fire engineers, and then we basically bring together their specialist knowledge and then assess risk, basically, which is a lot of what the profession is about, but not everything is about it. Then it turns into the rest of my sort of day job is writing up reports and making recommendations and writing legal documents for local authorities to serve on the responsible person to actually make these buildings safe, basically. So it's part legal, it's part relationship management with the local authority, and there's a certain degree of analysis of information and documentation that we're able to request from the responsible people. So there's so many different parts to the job that it's thrilling some days. It's really quite inspiring to work in the profession, to be honest. It's every day is different, which is what really attracted me to it in the first place. And there's so many different aspects to it that should I get bored of an area, I can then move into another area should I wish. But I've moved into housing effectively throughout my career, and I don't think I'd particularly want to change from that, because there's different aspects within that as well, in terms of licensing and HMOs and disabled facilities grants. There's so many different sort of aspects, and you can find an area that suits you, really. And we're always in demand, which is a nice part of the job, in that you've got a really good job security with the profession.
Yeah, thanks for that, Richard. And I think what you've really illustrated in your response is the fact that the role is so varied. So, you know, one day you're out on site doing very sort of practical, hands-on type work. Then you're sort of in an office doing the sort of writing up. But I think the thing that really stands out for me is the way that environmental health officers interact with other professions. You do collaborate, you know, with a whole load of other professionals, with the public, and that's, for me, that's the really exciting part of the job. Actually, is you know, the whole thing about you don't know what the next day is going to bring, but you do meet so many different people from so many different walks of life, and there is this real balance of practical, you know, the sort of writing up, and it really is amazing. So Sam, now your role in contact tracing is a new role, and I think it's really interesting that you've sort of recently qualified, so you've not worked in any of the main disciplines of environmental health. So they are food, housing, environmental protection, health and safety, public health. Those, well, actually, COVID is right at the heart of public health. So you've gone straight into something very sort of specialist and very new, actually. Many environmental health practitioners across the country really have adapted during this current crisis and now doing elements of contact tracing and managing sort of large outbreaks in close contact settings like care homes. Tell us a little bit about this new role then, Sam.
Yeah, it's fantastic, really. I help manage a team which has been put together at speed. And we started off with 9 of us, and now we've gone to over 80 staff, and that's in June. We look after so every day is different, really. We're constantly learning new things. So really, a day for me would be first thing in the morning, we look at our queue. So in our queue, we prioritise any, like I said, care home staff, any school children, any schools, nurseries. They're priority because we're just trying to get people to isolate, trying to mitigate the virus and keep everybody safe. We do a lot of staff training. We do data collection and data analysts. Just really, it's a full-on day every day.
So the work that you're doing, really, in the same way as Richard and Lisa, you are really helping to save lives, in a very real way, aren't you? So, that's very humbling, I think, actually, and that must bring you into contact with some very interesting people, and probably some very sad cases as well. How do you deal with that?
Yeah, we have had some very sad occasions. The team at Monmouthshire, they all have brief training. So there's plenty of support put in place. There's different policies and procedures we follow for different types of calls. There is a lot of support there for them. Because, very sadly, we do come across the people that have had a bereavement. We've had some really sad calls.
Yeah, and probably people who are currently, because they're positive cases, I mean, that's why you're tracing them and their contact. I suspect a lot of them might be currently very ill as well. So, well done for that. So let's just think about then, what is it, Richard, about your job that you like the most? If there was one thing about your role, what is it that you love the most about your job?
I think having a purpose, having a very sort of strong purpose with my job. I think knowing the risks involved with unsafe buildings and the effect that the built environment has on everyone's day-to-day lives, and having the ability and the power to make people's lives better and safer is really why I get into the profession and what I really enjoy ongoing with the profession. That's probably the main sort of driver for me continuing with it. But I also enjoy the variation and the people that you meet through it, and I don't think that you can ever learn everything. It's something that you're constantly developing in the role, which is something that I really enjoy.
Thank you, Richard. How about you, Lisa? What do you like most about your job?
It's that interaction with so many different people, and like Richard said, no day is the same. You're always learning, constantly learning new things and new skills, meeting new people, and it's that whole exciting sort of arena that I don't think many other careers can offer the same level.
Yeah. Thank you. And Sam, what is it you love about your job? Because clearly, we're just speaking to you and seeing you in theatre. You obviously love your job. What is it about your job that you love?
I love everything about it. It's just, I just look at it. I've just been blessed with this fantastic opportunity. The role is so varied. I'm learning every day. I'm working with a fantastic team of environmental health officers that I just learn so much from them. We're meeting different people from the COVID side, the experiences we're picking up from that, we're helping to save lives. We're helping, we're starting to get people to isolate, to stop the spread of the virus. So we know we're serving a purpose. We're helping Gwent for what we're doing. Interaction with the different departments. We work very closely with different departments within the council. So I love it. I really do.
Thank you. So we've heard about the nice bits, guys. So what about the parts that are not so nice? Because look, we've got to be honest with our listeners here, because every job has the parts that are not quite so nice. Richard, what's the part of your job that you would say the part that you least enjoy?
The least enjoyable part of my job. We do come across quite a lot of safeguarding issues through my day-to-day role. This is before I came on secondment, and you do come across visiting the private rented sector. You quite often come across people who are hoarding, and quite often there's a sad story behind that. So there's that element of it. And you quite often come across things like cuckooing of people's houses and things like that. So, which is when a house gets taken over by drug dealers and things like that. So I've been involved in numerous cases where that's happened, and there tends to be someone suffering at the bottom of the line there. So yeah, so I mean, you see all aspects of society, and you know, and though it's extremely interesting, you do also come across some of the more vulnerable people in society. And the good thing about the profession is that you can then see demonstrable change to their lives. You can get them rehoused, you can get them involved with social services, get them support where they need it, get them drug support and things like that. So there's to every downside of the job, there tends to be something that you can actually do about it. And part of the skill of being an environmental health officer is knowing all of the other sort of support organisations and other parts of the council that can assist with these problems and making referrals to them, for example.
Thank you, Richard. And Lisa, for you, what is the part of your job that you least enjoy?
I'm not sure that there is in my current role. Certainly in previous roles, it's the experiencing of, so I've also done a little bit of housing and seeing some of the conditions that some tenants live in. That was really hard to deal with. More recently, the business I work for, we've done an awful lot of food bank charity donations. Obviously, we have within hospitality, we're closing, reopening, so we have had a lot of excess food waste. So seeing that sort of turn it round almost, what is seen in unfortunate situations, being able to help those people. And I think that's the one thing we all do in this profession, whether we're in the private sector, you know, local authorities, whether we work for Public Health England, Food Standards Agency, we've all got that same end goal of improving conditions and life, you know, circumstances for everybody, whatever discipline we're working in.
Yeah, thank you, Lisa. And I think you've raised a really good point there, in that the opportunities for environmental health officers are in, you know, a whole multitude of sectors. So, you know, local government traditionally is where the most, you know, environmental health officers have been employed. But there are so many opportunities as well in the private sector, in academia. You know, government is employing environmental health officers, so places like the Health and Safety Executive, the Food Standards Agency, Public Health England, Public Health Wales, you know, these are all organisations, the Environment Agency. You know, we have environmental health officers working in all of those organisations, carrying out a real wide variety of roles. So Sam, just going to quickly ask, is there anything about your job that you don't enjoy? No, I thought you were going to say that. I thought you were going to say you love it all. It is early days yet, but it's really good to hear. So because we're sort of coming to the end of the webinar now, so just a couple more questions really about, you know, what are your aspirations really for the future? So Richard, for you, you know, what do you have any sort of ambitions, aspirations for what you want to do next? I'm
really enjoying my current role, to be honest, on secondment, and in terms of the future, the additional skills that I've been sort of equipped with should suit me quite well going into the possibly an enforcement role in the HSE looking forward, because they're taking on the responsibility under the Building Safety Act for enforcement in tall buildings. So so that's a possible sort of route of possibility at the moment. So I don't know if I will do or not. I may go back to my my day job at local authority, but that's certainly an opportunity that I could take.
Yeah, we'll look out and watch that space, because it would seem a natural sort of progression, wouldn't it, to your current role. So Lisa, for you, do you have sort of ambitions and aspirations? What are your plans?
Yeah, I want to just keep doing what I'm doing. I really do enjoy the private sector and hospitality, and for me, the business that I work in, there are potentially opportunities to do global work, so learning more about how it's done in other countries, and that's something that fascinates me and where I want to move forward into.
Okay, well, thank you for that. So I'm just going to end up by asking you all to give somebody who might now be thinking about looking at environmental health a little bit more seriously than they might have done in the past, or actually for the first time, if there was one piece of advice that you could give to our listeners, what would it be? So Sam, coming to you first, what would you say? What advice would you give
I'd
them?
say if they're looking for a diverse role, where they have the potential to do something different every day, whilst giving something back to the local authority, environmental health is the career for them. Just do it.
Thank you. And Lisa, any advice that you would like to give them?
Absolutely, just go for it. I hadn't done a first degree, so don't be scared of going back to education if that's the route to get your final goal, and just go for it. It really is fantastic and worthwhile.
Thank you. And just finally with you, Richard, any advice for our listeners?
I would say definitely research your degree course thoroughly. Make sure that you've got the time to dedicate to it, because it is a big commitment to do it. I personally did it in full time, and it was a lot of work. But I'm so glad that I did it. So yeah, I definitely recommend anybody getting into environmental health as a profession. It's no day is the same. There's so many different facets that you can get into, and you can make a real difference to people's lives at the end of the day, and that's what sort of drives us on.
Thank you, Richard. So we hope that we've inspired you somewhat today. There's lots of information about a career in environmental health on our CIEH website. So that all that remains for me to say is thank you to our panelists, to Richard, to Sam, and to Lisa, and to say to all of you listening, please keep safe, and hopefully we'll meet you in the not too distant future. Thank you.
Thank you.